All right, the World Health Organization says we can't let our guard down just yet.
The Omicron surge is starting to slow in a number of states, but has yet to peak in others, and that's challenging some hospitals.
UW Health Chief Quality Officer Dr. Jeff Pothof joins us once again for his weekly visit. Welcome back, Doctor.
Hi, Dr. Pothof.
Good to see you guys.
How are we doing here in southern Wisconsin? Have we peaked?
You know, maybe so. Our statewide data is suggesting that we may be coming off of our Omicron peak. And then to further kind of go along with that, statewide data is suggesting that hospitalizations are a little bit down. I'd say, here locally, Madison, at least our hospitalizations are still pretty high right now, but, hopefully we can join that trend soon.
Boy, that's encouraging to hear. Last week, we had 19,000 cases in one day, and a lot of people were wondering, well, maybe that was the peak. Were those numbers accurate?
I think there was an issue with how data was uploading within the state system that made those numbers not necessarily single day totals. So, I think in general, all those cases count, but they may not have all occurred on that same day. So I think it's fair to say that maybe we're coming off peak. Peak was probably last week, but maybe not to the same tune as some of those days would have you believe.
Are the testing rates still the same?
We're still seeing pretty high demand for testing. Lots of factors for that. Even though our rates are off peak, they're still really high. There's still like a lot of COVID in our community. So there's still a lot of testing happening. And I think, there's other testing that's happening, whether it's for events that people want to go to, maybe vacations, folks who, maybe need a test to return to work or things like that. So I haven't seen much of a drop off in testing demand yet.
Why is the Omicron surge raging in some parts of the country and not in others?
I think you can imagine there's a lot of different geographical kind of features that happen. So the easiest one is the first place to get it. It spreads so fast that you're likely to be one of the first places to then, come off the peak. If you're like us in Wisconsin, where, we weren't seeing the big surge at the same time that, say, New York or DC where it was, then you come off a little bit, more slowly. And you're kind of seeing that play out across lots of municipalities, lots of states, and even in different parts of the world. You're seeing places that aren't near their peak of Omicron yet.
The numbers are high, but people are not getting as sick if they're vaccinated and boosted. Is that correct?
I think that's a good takeaway message is if you're vaccinated, including boosted, you're very well protected against severe disease or death, unless for whatever reason you're severely immunocompromised. I think those folks know, they follow a different set of rules. But we are seeing our vaccines and boosters do a really nice job against preventing hospitalizations and death.
The free at-home COVID tests are now available from the government. It's that covidtest.gov. You can get up to 4 free tests. They're taking a while to arrive. People who ordered them last week or even 2 weeks ago may not have them yet. But do you recommend that people sign up and get those tests?
I do. I think, some testing at home is better than no testing at home, and they can be really convenient. If it's Sunday morning and you wake up and you got a fever and a sore throat and you're like, man, what is this? Might be difficult to find a test outside of your home. If you're having those symptoms and you take that test and it's positive, you have your answer. You can isolate. You can kind of plan your day around it. So, not perfect. And there's some instances where if you think you have COVID and that antigen test is negative where you'd want to get a PCR, I still think they can be pretty helpful.
And a lot of these tests are going to be sitting in mailboxes in sub-zero temperatures. Is that going to affect the tests?
The answer to that is we don't exactly know. So when these companies develop these tests, they try to expose them to reasonable temperatures. Unfortunately, Wisconsin falls far into the unreasonable temperature category with these sub-zero temperatures. So it's possible that these tests, when they thaw, will work just fine and give you similar sensitivity and specificity. It's also possible that if they stay frozen and they thaw, that they may be a little bit less accurate than what the manufacturer originally designed them for.
Well, as the World Health Organization said, don't let our guard down yet. We're not out of the woods.
Yeah, I think, the news is looking good, but there's still some work to do.
All right, Doctor. Hopefully better news next week.
Yes.
We'll see you next Tuesday.
Thank you, Dr. Pothof. We appreciate your time.